Diagnosis of gas gangrene and the other non-sporing anaerobic infections. Specimen necrotic tissue, muscle fragments, and exudates from deeper parts of the wound. Direct microscopy, thick, stubby, boxer shaped gram positive bacilli without spores are suggestive of Clostridium perfringens. Culture media, Robertson cooked meat broth, egg yolk agar, etc. Incubation anaerobically by gas pack or axonomat, etc. Identification of Clostridium perfringens, target hemolysis, double zone hemolysis, Nagler's reaction, opalescence surrounding the streak line on egg yolk agar. Reverse CAM test positive, heat tolerance test positive, and litmus milk produces Stormy clot reaction. Lab diagnosis for gas gangrene. Based on the clinical diagnosis of gas gangrene, treatment should be started as early as possible. Lab diagnosis has the role only for confirmation of the clinical diagnosis and the species identification. In this figure, we can see the gas gangrene of the right leg showing swelling and discoloration of the right thigh with bullae and palpebral crypticus. Specimen. Ideal specimen are necrotic tissues such as muscle fragments and exudates from deeper part of the wound where the infection appears to be more active. Blood culture may be positive for Clostridium perfringens and Clostridium septicum. However, Clostridium perfringens bacteremia can occur even in the absence of gas gangrene. Swabs rubbed over the wound surface or soaked in exudates are not satisfactory. Specimen should be put into Robertson cooked meat broth and transported immediately to the laboratory. Direct microscopy. Gram stain films provide clues about the species of Clostridia present. Absence of neutrophils in the infected tissues is a characteristic feature. Thick, stubby, boxcar-shaped gram-positive bacilli without spore, suggestive of Clostridium perfringens. And this figure we can see the gram-stain smear of Clostridium perfringens. Next, spore-bearing gram-positive bacilli suggest other Clostridia species. Citron bodies, boat or leaf-shaped pleomorphic irregularly stained bacilli with spores suggest Clostridium septicum, while large rods with oval subterminal spores suggest Clostridium novae. Identification. Clostridium perfringens can be further identified by the following properties. Culture plates should be incubated anaerobically at 37 degrees Celsius for 2 days. Target hemolysis. Double zone hemolysis on blood agar, Clostridium perfringens produce an inner narrow zone of complex hemolysis due to theta toxin surrounded by much wider zone of incomplete hemolysis due to the alpha toxin. Nagler's reaction, Clostridium perfringens produces an opalescence surrounding the streak line on egg yolk agar or media containing 20% human serum due to lecithinase activity of alpha toxin. Opalescence can be inhibited by incorporating the anti-alpha toxin to the medium. The test is also positive for Clostridium bifermentans, Clostridium barati, and Clostridium sordeli. All produce alpha toxin. Reverse CAM test. Clostridium perfringens is streaked over the center of the blood agar and Streptococcus agalacti streaked perpendicular to it. Presence of enhanced zone of hemolysis, arrow shaped pointing towards Clostridium perfringens, indicates the test is positive. Heat tolerance. Clostridium perfringens can grow when RCM broth is incubated at 45 degrees Celsius for 4 to 6 hours. This differentiates it from the other organisms in the specimen. In litmus milk, Clostridium perfringens produces stormy clot reaction due to the fermentation of lactose producing acid and vigorous gas. Automated methods such as Marlitov is currently the method of choice of rapid and accurate identification of various Clostridia species. Treatment. Early surgical debridement is the most crucial step in the management of gas gangrene. All devitalized tissues should be widely resected so as to remove conditions that produce anaerobic environment. Closure of wounds should be delayed for 5 to 6 days until the sites are free from infection. Antibiotics. Combination of penicillin and clindamycin is recommended for 10 to 14 days. Hyperbaric oxygen, it may kill the obligate anaerobic Clostridia such as Clostridium perfringens. However, it has no effect on aerotolerant Clostridia, Clostridium septicum. Passive immunization with anti-alpha toxin antiserum can be done. Now in the figures here, we can see in the first figure we can see the target hemolysis of Clostridium perfringens zone of incomplete hemolysis. The blue arrow shows this, and the zone of complete hemolysis by black arrow. In figure B, we can see the Nagler's reaction in which egg yolk agar is inoculated with Clostridium perfringens. And on the right side we can see egg yolk agar with anti-alpha toxin. And in the C diagram we can see the Clostridium perfringens and agalacti intersecting. There is a zone of massive multiplication also present. Now coming on to non-sporing anaerobic infections. Medically important non-sporing anaerobes can be classified into gram-positive and gram-negative groups. Beside the list, there are several other anaerobes that occur in soil and water and may be of industrial and agricultural importance. Anaerobes as normal flora. Non-sporing anaerobes are often a part of the common normal flora of mouth, GIT skin, genital tract of man. Common examples include oral cavity, anaerobic cocci, actinomyces, fusobacterium, bifidobacterium, pervotella, and spirochetes. Table. Classification of non-sporing anaerobes. Gram-positive cocci, Peptostreptococcus, Peptococcus. Gram-positive bacilli, Bifidobacterium, Eubacterium, Propionibacterium, Lactobacillus, Actinomyces, and Mobiluncus. Gram-negative cocci, Willionella. Gram-negative bacilli, Bacteroides, Pervotella, Prevotella, Porphyromonas, Fusobacterium, and Leptotricha. Spirochetes, Treponema, and Borrelia. Now, stomach, lactobacillus, intestine, anaerobic cocci, bacteroides, fragilis, fusobacterium, bifidobacterium, and prevotella. Vagina, anaerobic cocci, lactobacillus, prevotella, and bifidobacterium. Skin, propionibacterium. Beneficial role. Being a part of normal flora, they modulate various physiological functions of human beings. They compete with pathogenic bacteria through the depletion of nutrients and production of enzymes and toxic metabolites. They modulate host intestinal innate immune response. Bacteroids ferment carbohydrates and produce volatile fatty acids that are used by the host as an energy source. They are responsible for the production of vitamin K and bile acids in the intestine. Polysaccharide A of Bacteroides fragilis influences the normal development and function of immune system and protects against inflammatory bowel disease. Lactobacilli maintain the vaginal acidic pH which prevent colonization of pathogens. Clinical presentations. Anaerobic infections occur when the harmonious relationship between the host and the bacteria is disrupted. Disruption of skin and mucosal barrier by surgery, trauma, tumor, ischemia, or necrosis allows the penetration of many anaerobes, resulting in various infections. Anaerobic cocci. The anaerobic cocci occur as normal flora of the skin, mouth, intestine, and vagina. Peptococcus and Peptostreptococcus are gram-positive cocci arranged in pair or chain. They are normal flora of skin, mouth, intestine, and vagina. However, they are recovered from various clinical infections such as puerperal sepsis, skin and soft tissue infections, and brain abscesses. Pellionella are small gram-negative cocci occurring in pair or short chains. They are usually non-pathogenic. Rarely they can cause infections like meningitis, endocarditis, and osteomyelitis. Gram-positive non-sporing anaerobic bacilli. Bifidobacterium species, they are non-motile pleomorphic bacilli that frequently exhibit branching. The name is derived from the typical appearance bifid Y-shaped cells. They occur as a beneficial normal flora in the mouth and gut and mostly non-pathogenic, often used as a part of probiotics. Eubacterium species are commensals in the mouth and intestine. They are rarely pathogenic. Periodontitis. Propionibacterium species, they are related to Corynebacteria and usually labeled as anaerobic diphtheroids. They are skin commensals. Propionibacterium acne is the most common species which is commonly contaminant in blood and CSF. Taxonomically, they are reclassified as Cutibacterium acne. It can cause acne vulgaris and folliculitis. It can also cause prosthetic hip joint and prosthetic heart valve infections. Lactobacillus species, they are non-motile gram-positive bacilli that frequently show bipolar and barred staining. They are part of normal flora of mouth, gut, and vagina. It is often used as a part of probiotics. In stomach, lactobacilli is in the stomach. Example, Lactobacillus acidophilus synthesize vitamins such as biotin, vitamin B12, and vitamin K, which are useful to man. In the oral cavity, lactobacilli form acid by the fermentation of sucrose and other dietary carbohydrates, which dissolve the mineral components of the enamel and dentine, resulting in dental caries. In vagina, lactobacillus species in adult vagina, known as Dordaline bacilli, produce lactic acid that maintain the acidic pH of adult vagina, protecting them from various infections. In prepubertal and postmenopausal vagina, lactobacilli are scanty, which predispose to many infections. Actinomyces are the branching filamentous and aerobic gram-positive bacilli. Mobiluncus species are motile, curved, and aerobic gram-variable bacilli isolated from the vagina in cases of bacterial vaginosis, along with Gardnerella vaginalis. Gram-negative non-sporing anaerobic bacilli. Bacteroides fragilis is the most common commensal of human intestines. At the same time, it is also the most frequent anaerobe isolated from clinical specimen. They are non-sporing, non-motile, obligate anaerobes, very pleomorphic, appearing as slender rods or cocobacillary forms. Valence factor include capsular polysaccharide, lipopolysaccharide, enterotoxin. It causes peritonitis and intra-abdominal abscess following bowel injury, most common manifestation and pelvic inflammatory disease PID. It is also implicated in brain abscesses, chronic suppurative otitis media, bacteremia, endocarditis, and in empyema, producing foul smelling pus. Enterotoxigenic strains can cause diarrhea. Prevotella has many species grouped into pigmented Prevotella melaninogenica produce black or brown colored colonies. Colonies produce characteristic red fluorescence when exposed to ultraviolet light. In this figure, we can see the gram stain smear of Bacteroides fragilis in A and Fusobacterium species in B. Now continuing, it has been isolated from lung or liver abscess, mastoiditis, pelvic and genitourinary infections, and lesions of intestine and mouth. Non-pigmented examples include Prevotella denticola and Prevotella buccalis, which can cause periodontal disease and aspiration pneumonitis. Porphyromonas, it differs from Bacteroides in being asaccharolytic and pigmented. Porphyromonas gingivalis is responsible for periodontal disease. Porphyromonas endodontalis causes dental root canal infections. Fusobacterium species, they are long, thin, spindle-shaped bacilli with pointed ends. Fusobacterium nucleatum is a normal inhabitant of mouth and can cause oral infection, pleuropulmonary sepsis, CNS infection, example brain abscess, and septic arthritis. Fusobacterium necrophorum is the agent of Lemierre syndrome, a form of thrombophlebitis. Leptotrichia buccalis, formerly called as Fusobacterium fusiforme, are long, thin, spindle-shaped bacilli with pointed ends. They are part of normal oral flora. They are implicated in acute necrotizing gingivostomatitis known as Vincent's angina. Vincent's angina is an acute necrotizing ulcerative gingivostomatitis caused by oral anaerobes such as Prevotella and Fusobacterium and spirochetes such as Borrelia vincenti. The clinical presentations, laboratory diagnosis, and treatment of non-sporing anaerobic infections are similar to that of other anaerobes described at the beginning of this chapter. Okay, so this completes our chapter. Let's come on to expected questions. Rajesh, a 23-year-old male, was admitted 5 days after crush injury to the right leg following a road traffic accident. He had been treated by a local village quack. On examination, the wound, which was bandaged with a soiled gauze, appeared to be heavily contaminated with soil. The local muscles appear to have been crushed with the edema, pain, and excitement, and crepitus was felt on palpation. So clearly, this is a case of gas gangrene by Clostridium perfringens. We can write the clinical condition, etiological agent, pathogenesis, and the lab diagnosis as well. Lab diagnosis of gas gangrene and non-sporing anaerobes we can write. Okay, now coming on to the MCQs. Characteristic of anaerobic bacteria is foul smelling discharge, fail to grow in aerobic media and gas in the tissues, all can be seen. Principal toxin responsible for gas gangrene is alpha toxin, and the agent of Lemierre syndrome is Fusobacterium necrophorum. Okay, so this completes our chapter. Next, we'll be starting with Microbiology leprae infections. Okay, like, share, subscribe. Thanks for watching.